Actinic keratosis, AK, is a small rough patch of skin that appears on areas exposed to a lot of sunlight, like the face, ears, scalp, forearms, or back of the hands. It is usually harmless, but can turn into skin cancer if left untreated, so it is important to notice and manage it early. The main cause of AK is long-term exposure to ultraviolet UV radiation from the sun or tanning beds. People with fair skin, light hair, and many freckles are at higher risk because their skin protects less against UV damage. Other factors that add to the risk include a personal history of skin cancer, a weakened immune system, and certain chemical exposures, for example, arsenic. Typical signs are a dry, scaly, or sandpaper-like spot that is pink, red, or brown, a bump that may feel slightly raised. It can be itchy, tender, or sometimes bleed when rubbed. Think of it like a tiny sun spot that feels rough if you run your fingertip over it, similar to the texture of a tiny leaf stalk on the skin. Doctors diagnose AK by looking at the skin and often using a dermatoscope, a magnifying lamp. If unclear, a small skin biopsy may be taken. Treatment options include cryotherapy, freezing the spot with liquid nitrogen, like a quick ice pop. Topical creams, for example 5-fluorouracil imiquimod, that you apply at home for a few weeks. Light-based therapy, photodynamic therapy, where a cream is applied, activated by a special light, and then the lesion is cleared. The choice depends on how many spots there are and where they are located. Wearing a wide brim hat, sunglasses, and long sleeves whenever you are outside. Using a broad-spectrum sunscreen with SPF 30+, and reapplying every 2 hours. Seeking shade between 10 a.m. and 4 p.m. when UV rays are strongest. Checking your skin every month, ask a family member to help you feel for any new rough spots, especially on sun-exposed areas. Recent advances focus on easier and more precise treatment. New field therapy creams, for example tirbanibulin, work faster with fewer side effects. In addition, research on immune checkpoint creams aims to boost the skin's own defenses to clear AK before it becomes cancerous. Early studies also show that AI-driven apps can help people spot suspicious skin changes